Can I get pregnant from kissing?
It's standard question.
No, you'd be surprised. There's something wrong about periods, that you can't go to a temple, you are untouchable, you can't touch plants, you can't touch food, you can't enter the kitchen. And it's amazing how extremely educated and well-to-do families still follow all of these myths and still ostracize women just because they're on your period.
Namaste everyone and welcome back to another fresh episode of 3XP by KRF Media. I'm Kunal Raj and we are here at Goa Beach Summit 2023. Really excited, really glad to have Dr. Deepti Pinto Rosario here and having such topics covered. So you usually ask people how you're doing. So how are you doing?
It's nice to be asked that for a change. I'm doing well. Thank you so much.
And talking about your work, how do you approach patients, when there is a serious topic, how do you approach?
I think you just need to be very honest with your patients and give them the opportunity to say all that they want to say and to ask all of their questions and be very upfront and kind with them.
3 frequently asked questions.
Does my vulva look normal? Can I get pregnant from, it can be things like oral sex or dry humping or basically things that will not get one pregnant. Can I get pregnant from kissing?
It's standard question.
No, you'd be surprised. You'd be very surprised.
Something that you are tired of answering people.
No. If I got tired of answering people's questions, I think I'd have to stop my Instagram page and stop being a doctor.
What do you wish you learned sooner?
I wish I learned to be less taboo about all of these things sooner, because honestly speaking, it's part of how we're grown up and we're brought up. And only in the recent years, I myself have become more open about these things, and I wish it had happened sooner.
Yeah. Most common myth in a field of work.
I think there are a lot of misconceptions about sex, basically surrounding sex. How you get pregnant, how to have sex to get pregnant, contraception, what condoms, are they good or bad for you. So everything surrounding sex is so taboo that that's all just one.
Yeah, on Google you get 20-25 different answers and then they're like, what is the correct one?
Google is not the place to go for your answers, no.
What is the most strongly held belief?
The most strongly held belief. I think that periods are dirty is something that is still a very strongly held belief in India. That there's something wrong about periods, that you can't go to a temple, you are untouchable, you can't touch plants, you can't touch food, you can't enter the kitchen. And it's amazing how extremely educated and well-to-do families still follow all of these myths and still ostracize women just because they're on your period.
Can you explain some advancement in your field, in technology and...
Gynecological surgery has gotten a lot more advanced these days. So before we used to do a lot of open surgeries, by having to give a person a 9-10 centimeter scar on the abdomen. But now we can achieve the same thing laparoscopically by using long instruments and just 1 centimeter incisions. We can remove entire organs. And even more recently now we have robotics. So robotics is a thing where the patient is being operated on by robots. So there are robotic hands. And there is no doctor around the patient. The doctor is sitting away at a console and kind of operating the hands remotely. So the patient is being operated in one place, the doctor is sitting and operating in another place on that.
But how then there is a risk of patient, in that pain moving around?
No, they are anesthetized. No? So it's under anesthesia. So it's a very advanced field. But that's the...
But that is there here in
science.
Goa?
It is. It is there. It has recently come to Goa in the past 1 or 2 years, but it is available, yeah.
Sorry guys, I have no idea. So okay, so how do you address any concerns or fear that a patient may have about their reproductive health?
So I let my patients speak. I think that's very important. Many patients don't feel heard. And a lot of times they need to vent and everything needs to really come out. And once I have a good idea of what their concerns are, then we proceed with the necessary investigations. We look into what the problem might be. We come to a conclusion and then we try to get through it as a team.
You need to be a good listener.
You need to be a good listener, of course.
Yeah. Having all the patience and
Yeah.
and you have been posting posts on Instagram, right? Regarding more awareness. So how is that going on? Like response and stuff.
It's going really
Or
well.
getting more of like or something? No, right?
I mean, I do talk a lot about sex, so I do get some flack over there because I think some audiences are not ready for it to be spoken about because it's still India and it's still a little bit of a taboo subject. But other than that, I think people are really responding well, and these are things that need to be known. There are just too many myths and misconceptions. I think everything is it's just there. It's just matter of fact, and things need to be clear. It's happening whether you're able to accept it or not. It's still going to be happening, right? So it's better that people have the right information about it.
But Instagram, does it take down some of the posts? Because it has some community guidelines and stuff if you're posting.
So I don't post anything that's been taken down, but there is this thing called shadow bans. Have you heard of shadow bans? So when you say sex or when you type the word sex, some people say that Instagram kind of shadow bans you where they don't push out your posts as much. So we creators have this thing where we'll write sex, but instead of E, we'll put the euro sign. Little hacks like that to prevent being shadow banned by Instagram.
But what if you're saying the word, then you mute the word and you put?
I don't, because then what's the point?
Then
the
you're
whole point
shadow
is,
banned already.
Then there's no point to what I'm doing,
Yeah.
The whole point is to take away the stigma from all of this.
You're already shadow banned. How do you handle cases involving high risk pregnancies and what kind of support you provide?
So we work as a team, my husband and I. So we have our extended team of anesthetists and pediatricians and all of that. We have an ICU set up in our hospital. We are extensively trained in high-risk pregnancies. So we provide the best care to our patients.
Where do you practice?
I have my own hospital in Porvorim. Do you know Porvorim? It's just across the river from Panjim. Yeah, so it's called Pinto Rosario Hospital and it's a family thing. It's been around for a long time.
Hospital by the beach, by the river?
No, it's not by the river. It's in a little sleepy village called Porvorim.
Usually people have this notion that only rural people have misconception about reproductive health. Is that really the case?
Not at all. Not at all. I think it has no discrimination. Okay, so because people tend to be very secretive and taboo and parents feel a little shy still to talk about these things openly. So even people from supposed well-to-do families, they tend to get their information from the worst places like pornography or their peers.
I think that's pretty much with this short little podcast.
Thank you so much for having me.